Hello, good afternoon guys. Welcome to MK Community Brokers. My name is Mohammed. In this quick video, I'm going to explain to you about the access to your medical records. Basically about protecting your privacy, what information can you give to third party, and such and such like that. So, always keep in mind that New York State law requires all health practitioner and facility to grant patient access to their own medical record. Meaning that every time you want your own medical records, you may do so as well. If you want to get your medical record, you can ask your doctor or the hospital, whichever one, and they have to give your medical records. They cannot deny you from that. You can always contact them to get the medical record. If the hospital fails to acknowledge your request, you can also make a complaint at the number listed over here, 1-800-804-5447. They should be able to help you out if there's any issue. If the hospital does not basically deny you access and does not help you out as well. There's some glossary that a person needs to know about advanced directives, discharge notices, diagnosis in later group, discharge plan. These are some of the terms that a person should know whenever they're going to, like some medical, such as jargon that person should know. Always keep in mind that they always have to let you know in writing whenever you get discharged. Discharge is something that you're going to be released from the hospital. You're no longer in the hospital care, so keep in mind every time you get discharged, they have to provide in writing. They have to provide documentation. They have to let you know what the reason for discharge is and what you have to do for follow-up. So keep in mind with that part. This is about Medicaid and medical misconduct. Keep in mind that if you feel you have received poor, standard, incompetent, negligent, or fraudulent from a doctor or physician that they did not do properly, you can always file a report with the New York State Department of Health and Physician and other health professional, and you can always let them know that if they did any negligent work and what they're not supposed to do, you can always contact them as well. Patient's representative. The patient representative is a member of the hospital staff who serves as a link between the patient's family physician and other hospital staff. The patient representative should be available to answer questions about hospital procedures, help the special needs or concern, and help solve problems. So keep in mind they're very reliable. If they usually have it in the hospital, you can always ask them questions and they should be able to help you out as well. Keep in mind as well. I'm going actually over the main bullet points that I should go over. I'm not going to go over every single slide. If you guys want to pause the video and read this on your own, you may do so as well. But I just want to cover the main heavy hitter points of everything. So this is called the Patient's Bill of Rights. If you're a patient in the hospital in New York State, you have a Bill of Rights. For example, I'm going to read some of the bullet points. You understand and use these rights. If for any reason you don't understand, if you need help, the hospital must provide assistance, including the interpreter. Number 3, receive considered respectful care and clean an environment free of unnecessary restraint. Receive emergency care if you need it. These are all your Bill of Rights. So if any of these rights are not been used properly, or you feel like they have neglected on their duties, you may always make a complaint against them. That's the number provided before. Important message regarding your right as a hospital inpatient. Your fight while a hospital patient, you have the right to receive all the hospital care that you need for the treatment. If you're like injured, your discharge date is determined by your health care needs, not by your category of your insurance. So let's say if they look at the insurance and they want to say, you know what, let me discharge you early because the insurance is not going to cover it. They cannot do that. They have to discharge you according to your health needs. You have the right to be fully informed what's going on about your decision. You can always ask questions about them. Always ask if you think you don't understand it. Ask multiple times. If you think you're being asked to leave the hospital too soon, you could always make a complaint against them. Your notice will stay, like going to appeal, and you can always take to the court if they ever tell you to leave early. Admission notice for Medicare patients. You have the right under the New York State law. Before you are discharged, you must receive a written discharge plan. You or your representative leave the right to be involved in discharge planning. Your written discharge plan must describe the arrangement for any future health care you may need after discharge. Not only that once they discharge, they should tell you like you should follow up with your provider, see what they can do. If you do not agree with the discharge plan, you believe that they reasonably let you know. You can always call the New York State Health Department investigation. You complain at the safety of your discharge, and they'll do an investigation for you on your behalf. This is an important message from Medicare about your rights. That's the telephone number of question and answer, 1-800-845-5440. They are always there to help you out if you have any questions about discharging too soon or anything like that. They should be able to help you out. You can always appeal the discharge. You have to contact the representative at the number listed over there. Name of it's called Eventa, 1-800-815-5440, and they should be able to speak to somebody and leave you a message, and you can begin the appeal and tell them, listen, this is the hospital name, this is the provider's ID number. Keep in mind you need their ID numbers for the hospitals, whichever staff you're working with, and just keep in mind that the more information you have of the particular nurse, doctor, healthcare professional, whoever it is, and they act in an unprofessional manner, just take their names down and then make a complaint with the New York State Department of Health and Investigation, whoever you have to make a complaint to. Notice of instruction, the important message for Medicare. Part of the important message for Medicare, a header: hospital must display the Department of Health and Human Service header for Medicare, Medicaid services, and the OBM number. Body of the notice. Report concern you have about the quality of care you receive to the quality improvement organization listed here. A lot of times, usually not the private hospital, but public hospitals, with the government hospitals, are the ones that usually file a complaint to us. And the reason is because a lot of times the government hospitals, nurses or healthcare practitioners, they're on your team on a tenure where they can't be touched, and in a union. Keep in mind, no matter who they are, if they've ever disrespected you or they've been in any negligent manner, they haven't explained to you, just make a complaint. Just get their names down in nice manner, and just give me a call the number and just make a complaint. It just takes 2 seconds to do that if you feel that you've been abused and neglected by them. Deciding your about healthcare, a guide for patients and family. Introduction. Who should read this guide? Well, every person that's a patient. If you have insurance, you should read this guide. You should be knowledgeable about your own healthcare profession rather than getting from a third person that does not know about anything about your insurance or about your rights. Can the patient or other decision maker find out about the patient's medical condition and propose treatment? Well, anyone could find out as long as you give them the permission to do so. Adult patients who have the ability to make informed decision. Do adult patients have the right to make their own healthcare decision? Absolutely. As long as the adult person has not basically gone to a point where they have Alzheimer's disease and they can't make a decision. That's something different. Unfortunately, because of the mental condition that they have. But if they are good indeed and they are able to be vigilant and actually answer questions, then this should not be a problem. How do healthcare agents make decisions under a healthcare provider? Well, there's healthcare decisions just as if the healthcare agents were the patient. The healthcare agents make healthcare decisions according to the patient's wishes. So, again, it's all up to the patient. If the patient wants to give somebody rights, they can do so as well. What is a domestic partner? Domestic partner is a person who has entered into a formal domestic partner recognized as a local, state, or national government, or this person has registered as a domestic partner with a register maintained by the government or employee or this person. So this is all examples of domestic partner where they live together, their home ownership or lease, whatever it is. Who qualifies as a close friend? A close friend is any person 18 years of age who is a friend of a relative of the patient. This person must have maintained regular contact with the patient, familiar with the patient's activities, health and religious or moral health benefits. There's a lot of things, as you can see, that talks about over here. Obviously, there's always the best chance, but again, it's always up to the patient to give rights to any person that they have. In the end of the day, it's the patient's main decision. These are all the other things that a person should read. You can always pause the slide, read it. Like I said, I'm going to go over the main bullet point. What if an unmarried minor patient has decision-making capacity and is a parent? What if he or she is 16 or older and living independently from his or her parents? Such minors can make decisions to with or withdraw life-sustaining treatment or their own if the attending doctor and these review committee agree. This is a little bit different. A minor coming into a doctor, let's say, want to make an important decision, that's something different. They're going to consult with their own review board and see if this is how it should be. So keep in mind, not every situation is different, like I said before, but certain situations a patient can forfeit the rights to somebody else, but not all the time. What does it mean when the recommendation or advice of the Ethics Review Committee are advisory and non-binding? This means that the surrounding highest in priority can make a legal healthcare decision. He or she can do that even another person lower in priority or the subrogated list or other continue to disagree with the surrogate decision maker. A lot of times what people will do is they will give decisions to somebody, let's say if they know unfortunately they're not going to live, they'll give the decision to somebody else, and whatever it is, like the will and stuff like that. I think that's what they're trying to talk about with the committee. They'll make decisions for you. Healthcare proxy, appointing New York State. The healthcare proxy law allows you to appoint someone you trust, for example, a family member or close friend, or make healthcare decisions for you if you lose the ability to make decisions yourself. By appointing a healthcare agent, you can make sure that the healthcare provider follows your wishes. So basically, like I said before, this is like the when you give somebody your medical rights. About the healthcare proxy form, these are some legal documents you should understand before you sign to contact anything. You will start making decisions for you when your doctor determines that you are not able to make healthcare decisions for yourself. Now, that's not going to automatically mean that you're good in condition and that you already have a proxy agent for you to talk behalf. But as long as you are good condition, you are able to make sound decisions, you will still make the decision for yourself. Once they start realizing you can't make a decision, then you can't do it anymore. Why should I choose a healthcare agent? If you become unable even temporarily to make healthcare decision, someone else must decide for you. Healthcare providers often look to family members or guidance. Family members may express what your wishes are related to a particular treat appointment. An agent lets you control for medical treatment by all these listed below. So basically, this whole chapter is basically talking about what the rights of a healthcare agent is and what they can and cannot do. So keep in mind, you should read this on your own. So in order for you to know what it is. There's certain things you have to follow in order to become a healthcare proxy agent form. So keep in mind, you just have to fill out certain things, and once you fill it out, you'll start making the decision for yourself. So it's kind of simple form. You just put down I hereby appoint home address and telephone number, optional alternate agent. If there's another person you want to put as an alternate agent, you may do so. Read these questions, your identification, your option, and your statement of witness, and once you do that, you should be done. Statewide Planning and Research Corporated System. This is to notify all hospital patients that the New York State Department of Health has developed statewide system known as the Statewide Planning and Research Cooperative System, and that all accurate required to submit to SPARC certain billing and medical record information from patients. This information will be used for financial studies utilizing review, health planning, and pathology and research studies. So basically, this is what I'm talking about. If you don't want them to have it, you can always contact them and deny your request. It's up to you. Maternity information. This is about maternity if you want to read. Notice by paternal and maternity patients. Are you and your baby safe? This is for if you have a child in a hospital. You might not be the domestic violence. If a lot of times what happened is a lot of these people might be in a relationship which is very abusive and very dangerous. So they always help you out with anything you have. If they will always tell you you're not alone, you're not to be blamed, you do not deserve to be abused. They will ask you questions and they will give you the appropriate help as well. Obviously, once that happens, it's up to you if you want the police department to be involved or not. But that's completely up to that person, the individual. You remember if these are some of the hotlines, domestic violence hotline. This is the numbers over here listed. National Committee to Prevention Child Abuse, Office of Children and Family Services. If the mother is giving birth to a child and the mother's abused, and obviously the child might be in future trouble, you can always contact any of the 3 numbers listed, and they should be able to help you out as well. This is again the Parents' Bill of Rights. That was the pages. Now this is the Parents' Bill of Rights. Keep in mind you should always read this. And basically that's about it. Thank you again guys for watching this video, and I hope you guys enjoyed it. I hope you guys learned something from this. I might have not done a 100% good job. You can always pause the video and read this on your own. A lot of people don't realize that this is very important. We're always going to be, hopefully not all of us, but some of us might be in an unfortunate situation where we might be patients to the hospital system. So if you are a patient, you should know at least your right and see what you can do to prevent anything that might be happening to you unlawfully. With that said, thank you again guys for watching this video, and I hope you guys enjoyed it. Thank you.